Okay. Again, my name is Teresa Twomey, and I'm nursing faculty at Quinnipiac University, and I'm the second half of this presentation. And oh, sure. So again, I just want to reiterate what our focus is looking at what potential influence interprofessional teams might have on health outcomes with families who have children with special health care needs in a Latin American country, specifically in Nicaragua that we're looking at, okay? So as Sue just mentioned, we go to Nicaragua. Our first delegation from Quinnipiac University actually began going to Nicaragua in 2004. And in 2007 was when we began our alliance, or we began working in conjunction with Alianza Americana as full-time sponsoring partnerships that help us in Nicaragua. And we are focusing on the interprofessional teams of occupational therapy, physical therapy, and nursing. So the first delegation of physical therapy students went in 2007, and they functioned fairly independently. They did their physical therapy. And then in 2010 is when occupational therapy began. And nursing delegations had originally started going to Nicaragua in 2005, but again, we all functioned very independently, which is what has happened historically, which is why there's very little research or literature out there about that. So nursing started going to Nicaragua in 2005, and we went for a couple years, but then we stopped for a couple reasons. We started again in 2010 for 3 trips, again doing very independent things, but again, we needed to stop due to a couple reasons like faculty resources. We just became a school of nursing. We acquired a dean for the first time. So there were some issues that went along with that, that we were not able to go back. With having a new dean, part of her focus then became making this trip about interprofessional work. So we restarted going again with a nursing delegation just this past March 2016 with an interprofessional focus. So I mentioned the families and the children that we see are children with special health care needs. They might have diagnoses of spina bifida, hydrocephalus, so they have all different congenital as well as long-term illnesses. And our families are chosen by an organization called Los Papitos in Nicaragua. And what this organization does, it provides various therapies for children who have special health care needs. And we work in conjunction with Los Papitos to identify these families that may not be receiving OT-PT services already, or they might have come but had to stop because possibly lack of parental support, maybe it was too far for them in a rural not close to the city, so they weren't able to get in for PT-OT services. Maybe the child was wheelchair bound and they couldn't use public transportation, or they couldn't afford a taxi. So just for various reasons, Los Papitos worked with us to identify whose families might be benefit from these services. And once we start seeing these families, they're generally they stay with us for about 3 years. They do come off for things, unfortunately, like if the child passes away or if they become extremely ill. Otherwise, they will stay on service, and sometimes even longer than 3 years if they find the needs go on. Okay, so they don't typically, and they do come off so that we can allow other new families to come into the program also. So when we are looking at how we're going to do this interprofessional project, occupational and physical therapy students, and they're graduate students, they make their visit to these families in January. And then nursing goes again in March. And then families are visited again towards the end of the summer and that could be by PT-OT students again, by faculty, so that they can be planning or updating their plans of care, admitting new families, visiting the families. So they're visited again at that time. And what's really nice, this is how social media has really helped us. We are also able to keep in touch with these families through things like Facebook, social media. They can email or they can Facebook us with any difficulties they might be having, and vice versa. And they are very much, they love Facebook. So they are very much heavy users of social media. And then also, Alianza Americana does keep in touch with these families, and they go out and they make home visits. At Christmas time, they make baskets, and they bring them out to the families with things that they might need. So there is continuous support year-round for these families that are part of the project. And the data that PTOT has gathered are things like range of motion, mobility, the things that go along with PTOT services. They also do a lot of education, teaching. They are also trained in, I think they call it cardboard mechanics, where they make things out of cardboard to help with the PT and OT needs that the families might have. And I'll have some pictures that can show you some of the things that we've made. And then as nursing students going over there, and right now it was just undergrad, when Sue has her nurse practitioner students going over there, they'll also be able to visit these families in the home and from that perspective. But the data that we gather are the anthropometric, height, weight. Those things are so important for indicators of growth and development for children. So we get those things. We follow up on how their mobility is doing, how is their stability doing, what is their range of motion. And what's important to remember about all this stuff is that we are following our nursing plan of care as well as the plan of care that's been established by PTOT. We also re-educate them on aspects of activities of daily living, as well as on the plan of care that was developed for them by PTOT. And one of the most important aspects about this interprofessional project are the case conferences that we have before we leave for delegation, as well as when we come back. So before we left this past March, we had a case conference with PTOT where they taught, and right now there's 8 patients that we follow. So they brought up each of the patients, what their plan of care was, what they educated the families on, what kinds of equipment were out there. They told us what it was that they would like us to follow up on. And then when we returned in March, we debriefed with them about what we'd found as far as their plan of care, and then we gave them our data too from a nursing perspective. Okay? And the following pictures, I'm just going to explain to you a little bit about what it is with what we did with some of the children that we visited. Now, if you can see, I like to use a laser pointer. Okay, this right here is a slant board. And this is all made out of cardboard. And this slant board is for these children to be able to spend time on their tummy. Okay, and their head goes over, and it lets them be able to use their upper extremities. So we actually followed up with this mother to say, because it was in her plan of care, that this child should be on the slant board 20 to 30 minutes a day. So she can even learn head control, if she can learn to push herself up. So we were assessing how was she doing on the slant board, as well as how is the mother, does she do it? Does she use it every day? Is it still working? And because that's made out of cardboard, we just needed to make sure that everything was going well with the slant board. For this child here, the tray, and if some of you are familiar with wheelchairs that are made for children with special health care needs, they usually have a tray that slides in. But all of the equipment and this is equipment that we've brought over there through donations from Yale, from a lot of various places. We have a lot of donations. But this wheelchair did not have the tray. And it's really important for children with special health care needs when they're in their wheelchair that they do have a tray, their arms are not hanging, that it's up there. So this tray was made by our physical therapy and occupational therapy students out of cardboard. And if you can see right here, this tray was collapsing. So this was one of the things that we did. We made sure the tray was still being used, but we had to make an adaptation right here to make sure it was stable. We made sure that she still properly fit in her wheelchair, that her parents were putting her in the wheelchair. It is a very cultural thing for Nicaraguans to carry their children. They carry them. So we needed to make sure, and they will do everything carrying their child. So we said to the mom, it's really good if she goes in her chair. It gives you a chance to do things, and then she gets to sit up in her chair, and she can do different things with her tray in front of her. Okay? So those are some of the things that we follow up with too. And then if you can see her little hand right there, this next slide is, a close-up view. We noticed when we went in there, we also carry a yoga mat that we cut things out of and we use pieces of it. Her hands were constantly like this, and she was actually starting to get sores in here because her fingernails were cutting into her hand. So one of the students is like, I'm just going to take that yoga mat and cut a little piece, roll it up, and put it in between, which seems so basic to us. Doesn't that basic nursing? So we put it in there so that she wouldn't be doing that, and we clipped her nails so that she wouldn't be doing that to her hand. So that's also part of what we do, and we educated the mom on how the rolls will help her keep her hands not so tight, okay? And we were very fortunate to have one, since this was our first trip, to have a physical therapy faculty and an occupational faculty come with us so that they could show the students about the equipment that they had brought over. And this little boy, we brought him a walker over, and we wanted to make sure, again, that his parents were educated on how to use the walker if they were using it. And this little boy's house, in his house, it's very common in Nicaragua, they don't have finished floors. It's all dirt, and it could be dirt with holes, with boulders. So his floor was not finished. So we needed to make sure that the mother could put him someplace that was safe for him to use his walker because he had unfinished floor. So we were assessing all of that, and the mother was also taught to give him tummy time. So we put him on his tummy to assess how is he doing on his stomach, and he looks perfectly happy there. And he could actually scoot along the whole length of the couch, which we put him on, and he's doing good about lifting his head too. So these are some of the things that we followed up on also. Okay, and this next slide, this little boy is blind, and we actually brought him that walking stick. And we needed to make sure that he was using the walking stick appropriately, sweeping, doing it, so we follow up to make sure of that. And part of what we do too is check their stability. So was the family following up and putting him on his yoga ball so that he could develop core strength for his stability? Okay? And each of the families are given an instruction booklet that actually has pictures in it. It is translated in Spanish, but it also has pictures. We also do leave them DVDs and videos, so if that helps them remember how to use some of the equipment that we've left for them. And then as nurses and healthcare providers, we all know the importance of teeth brushing, and how our mouth carries so much bacteria, increases the incidence of infections because of bacteria in the mouth. So we, again, would re-instruct the family on the importance of brushing teeth. And with some of these kids, it's very difficult because they clench their jaw, and they're not good at opening their mouths. Bless you. So we we gave toothbrushes, or we reinforced if they ran out of toothpaste, don't even worry about the toothpaste. Even you just get in there with some water just to do things like that. So that was part of our education from a nursing perspective also. So for future steps for our interprofessional project, it's a pilot project, as Sue had mentioned to you. It's a pilot. And we will stay with these children for as long as they're receiving the services, and we'll admit new ones as they come on, but we are going to analyze the data that we collect. We've the collection data that's from PTOT, the data that we've collected as nursing students, and we're going to look for positive, negatives in growth and development, nutrition, weight gain, mobility, stability. And this is extremely important, as Sue had mentioned, because there is limited data out there that's currently published on the potential impact, or the impact that interprofessional teams actually have on the quality of care, on a collaborative practice in general, safety, satisfaction, and then improvement in the community, and importantly, cost savings too. So this project is going to be very longitudinal, since we're going to follow them for probably a few years, but collection of that data, and then importantly analyzing and then publishing for research. That's it. Any questions?
Question for yes.
What do you think the major issues are that nurses could focus on when they go there?
Oh gosh, it's a very, as some of you may very well be aware, like the rural health posts. We're fortunate that we were in Leon, which is a big city. We were able to do this, and we saw these families that were fairly close, but even so, some of the major issues are probably lack of the things, access to the care. I think even some of them don't have access to clean water. So I think it's a lot of the things that you might find in third world countries that are the barriers. Most of the care, as Sue had mentioned, the first point of care are in those health posts where they go. There's a physician, there's a nurse, there's even like community workers or CNAs that go there, but that doesn't mean they'll access it either. So it's probably a lot of the same things that you find in access to care, probably not that they're not intelligent, but lack of education around medical needs. There was this one little girl that we saw who had been on service for a while, and she had hydrocephalus with a VP shunt, ventricular peritoneal shunt. The hospital told her it failed. Sorry, there's nothing we can do. And they essentially sent her home to just die. And I'm thinking to myself, why didn't they put in a new one? But this is essentially what they said to her. There's nothing we can do. And in fact, they left the old shunt in. So, it's some of that kind of stuff when you're dealing with a third world country. So I'm sorry I can't answer concisely what it is, but I think there's a lot of variables and a lot of things that go into what could be a challenge or a barrier. Yeah.
Do you have weight scales to weigh?
We do. We bought one when we were there. And because we have a partnership with Alianza Americana, we keep it there. We keep our scale there. So we did weights, we did heights, head circs, chest circs. We did all of those types of measurements. Mm-hmm.
Another question.
I'm sorry?
My question is this. Is it a pediatric specialty? Is that why you guys are focusing on the kids? Is it pediatric rotation?
Well, it's not. Interestingly enough, we had juniors, senior level students, and our accelerated program. So it's not just, it's actually community focused as well. So our senior level students at that time were in their community rotation. Our pediatric students were in their pediatric. So it was actually a combination of both pediatric and community, which is very appropriate. Yeah.
Yeah, thank you. With the weights and the head circumferences that you do, do you plot them? Do you use the World Health Organization?
Oh yeah.
Growth charts.
And we're just collecting all of this data. So yes, absolutely.
Yeah, thank you.
Right.
Okay, I would like to thank Susan Agostino and also
Thank
Teresa
you.
Castro for this presentation.
Thank you.
And we are waiting for part 3.
Part 3. Yeah.